For the last 15 months, a committee of more than 30 leaders comprised of local and state officials, along with mental health professionals and law enforcement officers, have been meeting at City Hall to address the mental health and substance use crisis care services in our region. This committee specifically wants to address mental health and substance use crisis as they relate to law enforcement, incarcerations, the judicial system, the healthcare system, and the quality of care for the individual experiencing the crisis. This community-based leadership team has come up with a solution modeled after a Nashville facility that the committee visited last year. With this model, a person in crisis can receive immediate treatment, while in most cases bypassing the criminal and judicial systems, as well as our hospital emergency rooms. All of this can refocus the resources spent on our jails, law enforcement, and our judicial system to target the person in crisis, allowing for a greater chance of a positive outcome and a more productive citizen. The solution will affect people struggling with mental health, substance abuse disorders, and homelessness. It will also save thousands of taxpayer dollars spent by our local law enforcement agencies and has the potential to save thousands in expenses for our jails. It's a regional, scalable model that can be duplicated across the Commonwealth. We especially want to thank our lawmakers who have been supportive of this proposed regional mental health center.
Hello, I'm Judge Kim Gohagen, Warren District Court, Division 1. Thank you to all the legislators in the Brad area for your support of this project. We have a unique opportunity to join forces throughout our 10 counties to provide a valuable and essential service to our citizens. Over the last several years, I have noticed a common thread in the majority of cases throughout our court system, which is drug and alcohol addiction and mental illness. Our current system results in a burden on law enforcement, local jails, and the court system, and also results in a delay of services offered to individuals in a mental health crisis. We have an incredible opportunity now to make a change that will impact over 300,000 citizens in our community. Thank you all for your support of this anchor project.
I'm Chief Michael Delaney of the Bowling Green Police Department. But more importantly, I'm a member of this community. As a member of this community, I want to thank you, our state lawmakers, for their invaluable support and collaboration on the Anchor Project. In our city, like many others across the Commonwealth, we face the harsh realities of the mental health crises. Too often, those experiencing mental health challenges find themselves in situations where law enforcement intervention is necessary. We as law enforcement realize we need help to help those in need. The Anchor Project will provide the resources needed to give meaningful support. The Anchor Project represents a beacon of hope in our community. It is a testament to the power of collaboration between lawmakers, law enforcement, and mental health professionals. With the support of our state lawmakers, we'll be able to provide an innovative and proactive solution to mental health crises. Together, we are building a stronger, more compassionate community where individuals will have an opportunity to thrive. I want to extend my deepest gratitude to our state lawmakers for their unwavering commitment to the well-being of our community. Your support is instrumental in making the Anchor Project a reality. Thank you.
Hello, my name is Chris Coron. I'm a circuit court judge in the 8th Judicial Circuit of Kentucky. That circuit is made up of both Edmonson and Warren counties. It is my honor to support the Anchor Project. I've spent almost the last 25 years as part of our criminal justice system, not only as a public defender, a prosecutor, and now a circuit court judge. I can tell you the criminal justice system is a poor substitute for true mental health treatment. This type of facility and type of programming will allow people that are at the deepest part of a necessity that will get the help they need so desperately. We are very hopeful and would thank all of our legislators in the Brad District for supporting this project. This will truly transform South Central Kentucky and get those individuals that so desperately need the help they need.
My name is David Lanere. I am a family court judge in Warren Circuit Court, Division 3, and Edmonson Circuit Court, Division 3. From my seat in my courtroom, I observe families in crisis where parents or partners are either domestic violence victims or perpetrators, and children are usually wounded. From my seat in my courtroom, I observe parents lose custody of their children and sometimes have their parental rights terminated, most often because of substance abuse or mental health issues. From my perspective, those two problems can go hand in hand. There is a significant segment of our community which suffers with substance abuse and or mental health issues, or both, from every age group, from infancy to senior citizens. Sadly, it is not uncommon for infants to be born with neonatal abstinence syndrome, the withdrawal experience of newborns caused by in-the-womb exposure to drugs of dependence, most often opioids. In other words, that is what happens when children's birth mother uses drugs during pregnancy. Likewise, we have older citizens from teen years to seniors who face those challenges. And as our city and surrounding counties grow, so will the number of people who suffer with these conditions. I recall one night when I was the rotating on-call judge and received 7 calls in a single night for different individuals with mental health issues. The medical teams tried to find beds for the patients and searched from western state to eastern state to northern Kentucky, trying to find available beds. And that does not include the number of hours law enforcement and medical professionals dedicated to each patient. Of course, all nights are not like that. But as our city, county, and surrounding counties grow, we will grow closer to that type of demand for services. I recently heard someone say that when we don't have sufficient tools, available beds, and treatment resources to assist mental health patients in crisis, we lose families. At this moment, we have a wonderful and unique opportunity to expand the mental health services readily available to this area. Leaders in 9 counties of the Area Development District have pledged their 15 years of opioid settlement funds to the Regional Crisis Response Center. Such a commendable level of cooperation speaks to the important need for this facility. I see the need of it from the perspective of my work in court. I hope you will share our vision. We greatly appreciate the support of our state lawmakers who have worked with us in support of the Anchor Project.